This video we see about inborn errors of lipid metabolism. First we see about the definition of inborn errors. Inborn errors of metabolism are a group of metabolic diseases which can be formed as a result of the lack of single enzyme in a single metabolic pathway. Inborn error means the lack of single enzyme in a single metabolic pathway. These disorders are hereditary and tend to occur only in closely related family groups. So, inborn error means mostly it is a hereditary disorder. So, in lipid metabolism, the 6 diseases are referred as the inborn errors of lipid metabolism. One is Gaucher disease, Niemann-Pick disease, Tay-Sachs disease, Fabry disease, Refsum disease, Kraft disease. In this video, first we see about Gaucher disease and Niemann-Pick disease. Later, other videos we see about the other four diseases. First, we see about Gaucher disease. In this disease, cerebrocyte content of the reticuloendothelial cell is very high. Here, the main disorder is accumulation of cerebrocyte. So, the cerebrocyte is much higher in medullated than non-medullated nerve fibers because due to the deficiency of the enzyme glucoceramide hydrolase or glucose cerebrosidase. So this enzyme is very essential for the breakdown of cerebrocyte, but absence of this enzyme, the cerebrocyte will be accumulated more in the cells. So next is the symptoms in a Gaucher disease. The spleen is significantly increased, that is enlargement of spleen, and there are signs of leukopenia and thrombocytopenia. So WBC cells and RBC and the platelet cells will be, leukopenia means WBC, thrombocytopenia means platelet cell will be increased. The liver is enlarged and the marrow cavity is widened. Eyes show a yellow-brown wedge-shaped elevation. So eyes will be like a yellow-brown and then it's in a wedge-shaped enlargement. In early infantile form, the disease starts early and death occurs before attaining the age of 2 years. So the baby will be die before the age of 2 years. Neurological symptoms are usually present. So nerve problems also most common among the Gaucher disease. So next we see about the diagnosis and treatment. So first diagnosis, lab test. Blood samples can be checked. Check the levels of enzymes associated with the Gaucher disease. The enzyme is ceramide hydrolase. Genetic analysis can be whether the patient has the disease. Next is the imaging test. So, imaging means it's including for this diagnosis for the progressions, progression, that is dual energy X-ray absorption entry. They is shortly referred as DXA. This test shows low level of X-rays to measure the bone density. To measure the bone density, we have used this DXA. Next is the imaging test is MRI, magnetic resonance image. Using radio waves and strong magnetic field, and MRI can show whether the spleen or liver is enlarged and if the bone marrow has been affected. So using MRI, we can able to find out the enlargement of liver, spleen, and also if bone marrow will be affected or not. So these are done by using an imaging test, particularly MRI. Dual energy X-ray absorption is used for measure the bone density. Next is the preconception screening and prenatal test. It's an inborn error, so it is a hereditary. So before the person have a family history having hereditary Gaucher disease, they have to done a preconception screening and prenatal testing. Genetic screening before starting a family. If you or your partner is of Askanishka's Jewish heritage, or if either you have a family history of Gaucher disease. So already told that if you have a family history or hereditary of Gaucher disease, we have done a genetic screening before starting a family. In some cases, doctor recommended prenatal testing to see if the fetus is at the risk of Gaucher disease. Sometimes the baby is also having a Gaucher disease. At the time, we have done a prenatal screening. So that's all about the Gaucher disease. Next, we see about Niemann-Pick disease. Deficiency of sphingomyelin. Excessive amounts of sphingomyelin are deposited in the spleen, brain, and liver. So Here the accumulation is sphingomyelin compound. It is mostly found in the infantile. Death occurs within first 2 years of life. So it is also similar to the Gaucher disease. The death occurs within the 2 years. Causes. Niemann-Pick is caused by the mutation in the specific genes related to how the body metabolizes fat. So here the enzyme will be mutation occurs in the genes of mutation. Genes, that is mutation. The Niemann-Pick gene mutations are passed from the parents to the children in a pattern called autosomal recessive inheritance. This means that both the mother and the father must pass on the defective form of gene for the child to be affected. So autosomal recessive means both parent, father and mother have the defective gene that will be transferred to the children. So it is the autosomal recessive inheritance. Niemann-Pick is the progressive disease. There is no cure. It can occur at any age. So in all inborn errors, there is no cure. We can be able to maintain or decrease the pain only. Types of Niemann-Pick disease. There are 3 types of Niemann-Pick disease: type A, B, and C. So type A and B are caused by missing or malfunctioning enzyme called sphingomyelin. This affects the body's ability to metabolize fat, resulting in a buildup of fat in the cells. This causes cell dysfunction and over time cell death. So type A and B are mainly caused by the deficiency of enzyme sphingomyelin. So to the deficiency, it affects the body's ability to metabolize a fat. So it will be accumulated in the cells. So this may lead to the cell dysfunction or maybe death. So type A mostly occurs in infants who show severe progressive brain disease. There is no cure, so most children do not live beyond their first year. So type A of Niemann-Pick disease, the babies will have a death occurs before the 1 year. Type B usually occur later in the childhood, not associated with the primary brain disease. Most people affected with a type of B survive into adulthood. So type B for Niemann-Pick disease, they may be able to survive up to adulthood. Type C is a rare inherited disease. The genetic mutation of this type cause cholesterol and other fats to accumulate in the liver, spleen, or lungs, and the brain is eventually affected too. So type A and B, they are mostly affected the brain only, but type C is affected the the most in the sphingomyelin accumulations in the liver, spleen, and lungs, and also brain. So it is a very rare inherited disease. So type A and B are mostly all are due to the deficiency of the enzyme sphingomyelin. So they accumulated in the cells, they affect the cell dysfunction and cell death. But the difference between the type A, B, and C is main differences. Type A and B, they are mostly affect the brain. Type C, they affect the fat accumulation, that sphingomyelin accumulations in liver, spleen, or lungs, and brain also. But in type A and B, only the accumulations in the brain. Another difference is type A, infants may survive on up to the few years, first few years, that is within 2 years. Type B, they are mostly, if they can able to survive up to adulthood. So these are the different types of Niemann-Pick causes. Its signs and symptoms are clinical features: enlarged liver and spleen, mental retardation due to the brain affected. They have a mental retardation, a pattern in early life, anemia, and leukocytosis. The nervous system is affected. A cherry red spot may be seen over the retina. This is the retina. There is a red spot may be seen. Cholesterol deposits in the tissues are increased. Clumsiness and difficulty walking. These are the symptoms of clinical features. Other than that, excessive muscle contractions or eye movements, sleep disturbances, difficulty swallowing and eating, recurrent pneumonia. These are also the other symptoms of Niemann-Pick disease. Some infants with type A will show signs and symptoms in the first few months of their life. Those with type B may not show signs for years and have better chance of surviving to life adulthood. People with type C may not experience any symptoms until childhood. So they have the symptoms. We have at the end of adulthood, there are the symptoms. C, there is no signs and symptoms. So diagnosis. Type A or B. Using a blood or skin sample that is biopsy measures the enzyme sphingomyelinase within white blood cells to confirm the diagnosis. Type C. Small sample of skin to test immune disease as to how the cells move and store cholesterol. Other than that blood test, already we know that MRI, eye scan, genetic testing, prenatal testing. Magnetic RI is of a brain may show loss of brain cells, but in early stages of Niemann-Pick, an MRI may be normal because symptoms typically occur before the loss of brain cells. So, early stages we can't able to find out the brain cell death, or but later only we can see the cells death by seen through the MRI. Eye scan, eye exam. An eye exam can show signs of maybe indication of Niemann-Pick disease such as eye movement difficulties and then clumsiness and then retina, hereditary, that's what is the retina. Next, genetic testing. DNA testing of blood sample may show the specific abnormal genes that cause Niemann-Pick disease A, B, and C. DNA test can show who carriers are for all the types of Niemann-Pick disease. The mutation have been described in the first person and TNF only. Maybe it is the person is the first person or it is a hereditary can be checked by through the genetic testing. Next, the parental testing. Ultrasound can detect the enlarged liver spleen that caused by type C, and amylocentosis or chronic Miller sampling may be used to confirm a diagnosis of Niemann-Pick. So we can able to diagnosis through perinatal after conception. We have to take the amylocentosis and chronic Miller sampling. From this we can confirm the this diagnosis of Niemann-Pick system. Treatment. So any Inborn there is no cure, but only the treatment is available for the maintenance. No effective treatment is available for people with type A and B. For people with mild to moderate type C, a drug called milagastat may be optional. An internal study of 92 people with type C Niemann-Pick showed improved neurological symptoms after taking milagastat regularly for average of 2 years. So nowadays, this only studies look at drug on, they found that these drugs will recover or clearly cure or not cure, but they can support the these symptoms are decreased in the by this drug milagastat. Physical therapy is an important part to help maintain mobility as long as possible. People with Niemann-Pick disease need to see the doctors regularly because the disease progresses and symptoms may be worsen. So when the disease symptoms worsen, you have to check the connect the doctor and take that treatment. So that's all about the Niemann-Pick disease. These are the reference I used for this preparing the slides. Thank you.